Glimmer of hope for Alzheimer's patients from a conference that just wrapped up in Washington today.
2 experimental drugs may have slowed the progression of the disease. Dr. Max Gomez here now to explain what they could mean to patients and their families. Doc.
That's right, Maurice and Christine. The 2 drugs that drew the most attention both work by trying to prevent or remove the so-called amyloid plaques in the brain. That's what's thought to lead to the destruction of brain cells. But so far, every drug aimed at reducing the plaques has failed to slow the decline in memory and thinking process in Alzheimer's patients. Solanezumab, made by Eli Lilly, failed in earlier trials, but a new analysis of patients with mild symptoms seemed to show a slight slowing of mental decline. Another trial is underway to see if that holds up in a much larger study. Aducanumab by Biogen did slow cognitive decline in an earlier study, but it also caused localized brain swelling. Alzheimer's experts I spoke with today were lukewarm about the studies, saying much larger trials will have to show that taking the drugs do actually slow Alzheimer's. In any case, both drugs are still experimental and not yet available. So far, no drug has been able to restore brain function that's been lost. So a glimmer of hope, but no real breakthroughs yet. They're still working on it.
Tough one. Okay.
Yeah, it sure is.
Thank you, Doctor.
You bet.